What I think is important for all women, all folks with vaginas and vulvas to understand is that they should be able to center their own experience, their pleasure. And what happens is it becomes so normalized that sex is not for women. And this includes that women think that it's normal to be in pain during sex. How often do we hear that the first time you have sex is supposed to be painful, which is just fundamentally untrue. And because of this, in large part, we see a huge percentage of the population of folks who have vulvas and vaginas that are suffering through painful or unpleasurable or uncomfortable sexual experiences, and there's absolutely no reason for this to happen. We see that 75% of those with vulvas and vaginas will experience painful sex at some point in their lives. And it's true that in large part this pain is easily treatable, it's clear on its own, or it's situational, like an STI or a negative experience. But for up to 20%, this pain is persistent or even chronic. And that's a huge number. That's 1 in 5. This is so common, and it is not okay. You should not be having any unwanted pain during sex. It's why it's so important to understand what could be happening physically, psychologically, relationally, so that you can access the expert care and the treatment that you need and that you deserve, because you do deserve just fully satisfying, pain-free, pleasurable sexual experiences. In this session, I'll explain to you both what we put in the category of chronic genitopelvic pain, or a term that you'll hear a lot, which is dyspareunia, which means painful sex. We'll then talk about the kind of treatment that you might seek out, the kinds of professionals that you're going to want to see and to know and get really comfy with. And I'll leave you with what you can actually do, how you can help connect your brain and your body in a way that sets you up to have no unwanted sexual pain, that sets your relationships up to be able to have less distress or less of a distressing impact from pain, and that ultimately gets you back to a place of being able to have the most satisfying, pleasurable sexual experiences that your body is capable of. If you've noticed that intercourse, putting anything inside of your vagina, is painful, and that could start from a tampon, it can include toys, fingers, or penises, or other things that are equivalent size to a penis. If you're noticing that this is consistently painful, it's really important to seek out expert care. So I'm going to give you an overview of some of the words that will help you talk about what's going on for you, that will help you talk to medical providers, and also just give you a sense of there are words for this. This is a real thing, and this is something that's worthy of care and worthy of the best, most expert care that you can get. First of all, let's talk about the word dyspareunia. I brought this up earlier. It sounds like a big fancy medical term, but all it means is painful intercourse. It tells you almost nothing about what's painful or what's going on or where it comes from. But if it's a word that comes up a lot and that you're going to want to get comfortable with if you're talking about this with other folks. This refers to recurrent genital pain, not just the one-time thing, that can occur before, during, or after intercourse, right? So that before piece is really important because, as we'll talk about later, sometimes that pain comes up in anticipation of intercourse. And that can be really confusing, right? Nothing's actually touching my body yet. How can I be in pain? There are two big categories of dyspareunia that are different in the way that they're approached and treated. One is superficial dyspareunia. What that means is that there's pain with attempted vaginal insertion. If this is your vagina, if you try to put something in, you're going to notice pain at the opening. The other type of dyspareunia is deep dyspareunia. That's pain with deeper vaginal penetration and or when you're thrusting. These things are not always mutually exclusive, and it can be really hard to tell what kind of pain I'm experiencing. So if you don't know what type of pain it is, That's okay. That's why you're going to seek expert care. It's just a really good thing to have these words in your arsenal. Next, I'm going to talk a little bit about the word vulvodynia, which quite literally means dynia, pain, on your vulva. It's important when we talk about this to differentiate between the vulva and the vagina. A lot of folks get these terms confused, and they are different things. Referring to your entire genitalia as your vagina is like referring to your entire face as your throat. It's not accurate. The vulva is everything that's on the outside, everything that you could see with the naked eye, or more realistically, probably with a mirror, everything that touches your underwear. So this includes labia majora and minora, the outer and inner lips of the vulva. It includes the clitoris. If your clitoris is painful, it's called clitoral dynia, pain in the clitoris. And it includes the vaginal opening, again, right here. When it's the vaginal opening, we refer to it as vestibulodynia, pain in the vaginal vestibule. You may hear the term provoked vestibulodynia, or PVD. That's pain that's localized to the vaginal vestibule when provoked or touched. Provoked vestibulodynia is the most common cause of dyspareunia in those with vulvas and vaginas of reproductive age. I'm going to give you a big overview of what some causes of vulvodynia may be, because they are diverse, they're often overlapping, and it can be really hard on your own to determine this. But still, it's important to recognize why this is so common, how many different things can contribute to this. First of all, the most common cause of that provoked vestibulodynia that we see is hormonal. So we see this happen around what's called hypoestrogenic states, which is when your estrogen levels are low. This happens around menopause. This happens after birth when you're breastfeeding. And most commonly, it happens after long-term use of low-dose birth control pills. This is, again, something that's so common, and it's not often something that we get when we are put on the pill, right? Look out for this. Other causes of vulvodynia include infections like chronic yeast infections, HSV, that's the herpes virus, vulvar skin conditions like dermatitis or lichen sclerosis, things that affect the tissue, the skin of the vulva. We'll see neurologic or nerve issues that can lead to vulvar pain. We'll see anatomic abnormalities. So this might mean that you have a literal adhesion on your clitoris that causes pain. It could be that you have an imperforate hymen. The little bit of tissue that's right around the vaginal opening is designed to be really thin and stretchy and have plenty of space to allow something to enter the vagina. But in some folks, that tissue is too thick or the opening isn't big enough, and that can be excruciatingly painful when you try to put anything inside the vagina. Vulvodynia can also occur for folks who have cancer, or for folks who have gone through cancer treatment like chemotherapy or radiation. It can occur after any kind of trauma to the vulva or vagina. This includes giving birth, other obstetrical procedures, in extreme cases, female genital cutting. And what we also see are muscular causes of vulvodynia. So when the muscles surrounding the vagina, the muscles that act like a hammock to hold up all of the organs in the pelvic floor, are either spasming or they're too tight. They're not able to release and retract as we need them to in order to have good, healthy functioning. This brings us to vaginismus. Vaginismus is pain in the vagina. It's when the spasms of those pelvic floor muscles that surround the vagina cause vaginal penetration. This is with a finger, with a penis, with an object like a tampon, to be painful or impossible. And remembering that this pain can also come in anticipation or after penetration. You'll also hear the term hypertonic pelvic floor, which means that these pelvic floor muscles are stuck in a really tight space. It's important to recognize here that the pelvic floor muscles don't just surround the vagina. They also hold up all of the organs in our pelvis. So that means our uterus, That means our entire GI system. That means our bladder. So we see a lot of issues with going to the bathroom, pelvic pain, bladder pain, GI issues, right? These are all so correlated with the genital pelvic pain that we're talking about. It's important to recognize, and this will come up later, that vaginismus is often a secondary consequence. So comes after another vulvovaginal condition. Why does this happen? Well, your vagina is smart. And if it knows that there's something going on that's going to mean that penetrative sex is painful, what do those muscles do? They're going to clamp down to prevent you from actually doing the thing that's painful. It's a brilliant adaptive solution that the body comes up with. And it doesn't pan out so well because over time, those muscles become accustomed to doing that and it can cause even more pain. And sometimes, even once you've treated the original issue, it takes a while for those pelvic floor muscles to actually be able to contract and release in the way that we need to be able to have anything go inside the vagina. One of the most common causes that we see for that deep dyspareunia, which is that pain with sex, with penetration, with thrusting, is a condition called endometriosis, which affects 1 in 10 folks with vulvas and vaginas and uteruses. This is a condition in which endometrial tissue appears outside of the uterus, and pain with sex is one of the main symptoms that we see. Pain in the lower abdomen, lower back, pelvis, rectum, heavy periods, painful periods, spotting, constipation, abdominal fullness or cramping. It's really important. This is another bit of misinformation that women often get, that your periods are supposed to be excruciating, that it's normal to have to call out of work when you're on your period. That's not normal. There might be something going on. It's important to talk to your doctor about the possibility of endometriosis. Another similar diagnosis, adenomyosis, that will also lead to deep pain with penetration, and again, may also result in vaginismus, those muscles going, nope, don't come in here. We don't want anything here. It's too sensitive. It's too painful. Other things that might lead to dyspareunia. Again, we talked about how those pelvic floor muscles are holding up more than just the vagina and the uterus. So if you have a bladder issue like interstitial cystitis or bladder pain syndrome, this is where the lining of the bladder becomes severely inflamed. You may see resulting pain with intercourse. Pelvic congestion syndrome is a syndrome in which there are blood flow issues in the pelvic veins that can also cause pain. Gastrointestinal issues. How many people have irritable bowel syndrome, Crohn's disease, ulcerative colitis, even food allergies that impact your GI system? And again, all of those muscles and nerves in the pelvic floor. Also, just to note, there's something called persistent genital arousal disorder or genital pelvic dysesthesia, which is a condition that causes a feeling of constant unwanted arousal, often in non-sexual contexts. If this is happening to you, it is not normal. It does not mean that you're hypersexual, and it can be extremely painful. So make sure that you see a clinician around it.